In this video, I'm going to discuss the features of hemochromatosis where there is too much iron accumulation in the body. So primary or hereditary hemochromatosis is an autosomal recessive disorder that is due to the C282Y or H63D mutations in the HFE gene, as a consequence of which there is too much iron absorption in the duodenum. And there has also been shown that there is genetic association between hemochromatosis and human leukocyte antigen A3. So the two memory aids that I have for you is that HFE gene stands for high Fe. So Fe is the code for iron, so high Fe is associated with hemochromatosis. And then for the HLA-A3, think of the AAA batteries. So AAA batteries are made of iron. So hemochromatosis is associated with HLA-A3 subtype. And then secondary hemochromatosis is due to recurrent transfusions, like for instance in patients that have beta thalassemia that requires recurrent transfusions, as a consequence of which there is accumulation of iron in the body that can lead to the secondary hemochromatosis. And so in terms of the lab values, since there is too much iron in the body, therefore ferritin, which is responsible for the storage of iron, is also increased. But then transferrin, which is responsible for transfer of iron to different parts of the body, and transferrin is usually elevated in conditions where there is low iron. So transferrin is therefore low in these patients, and thus total iron binding capacity of this patient is also decreased. And so since we have low level of transferrins but high level of irons, all the sites on transferrins are saturated. So the transferrin saturation is also increased in this patient. So increased iron, increased ferritin, decreased total iron binding capacity, and decreased transferrin, but the transferrin saturation is elevated. Now in terms of features of this disorder, these patients will have liver dysfunction from cirrhosis, which increases the risk of hepatocellular carcinoma. Another feature of this disorder is diabetes mellitus, and that is due to the iron deposition in the pancreas, which causes problem with the insulin production, and thus patients can develop diabetes mellitus. There is also skin hyperpigmentation, and so it has a bronze-like appearance. So since these patients have both a bronze-like appearance of the skin as well as diabetes mellitus, the other term that is used to describe hemochromatosis is bronze diabetes. And this term is actually very high yield and will help you recognize this disorder on the exam. So if you see a patient that has hyperpigmentation of the skin as well as diabetes, or bronze diabetes is a term that is used for it, then start thinking of hemochromatosis. Other features of this disorder include cardiomyopathy, like for instance congestive heart failure or arrhythmias. These patients can also develop arthralgias. And then finally hypogonadism, as a consequence of which there would be impotence, amenorrhea in females, as well as decreased libido. And then finally, for the treatment of hemochromatosis, two options that are commonly used include repeated phlebotomies, where blood will be taken out of the patient's body, and so since blood has too much iron, this way you will decrease the level of iron in the body. So the reason that they will have to do phlebotomy is that there is not really any good technique for the body to get rid of the iron, and thus the total content of the iron keeps on increasing with aging. So one way to decrease the level of iron in the body is to take out blood which has iron, and thus by taking out you will keep the levels low. And then the other way is to provide with iron chelators like the deferoxamine. So phlebotomies as well as iron chelators like deferoxamine are treatment options for patients with the hemochromatosis. And that concludes our discussion.